Welcome, everyone, to this video exploring metachromatic leukodystrophy, or LD, is a rare, inherited disorder that progressively damages the nervous system, affecting a person's ability to think, move, and function. In this video, we'll delve into the causes, symptoms, diagnosis, treatment, and research surrounding this devastating disease. MLD is caused by mutations in the ARSA gene. This gene provides the instructions for making an enzyme called aryl sulfatase A. This enzyme is crucial for breaking down a type of fat called sulfatides in lysosomes, which are the cell's recycling centers. When the ARSA gene is mutated, aryl sulfatase A isn't produced in sufficient quantities or doesn't function properly. Consequently, sulfatides accumulate in the brain, spinal cord, and peripheral nerves. The buildup of sulfatides is toxic to the myelin sheath, which is the protective covering that surrounds nerve cells. Myelin is essential for the rapid and efficient transmission of nerve impulses. As sulfatides accumulate, they damage and eventually destroy the myelin sheath, a process called demyelination. This demyelination disrupts the communication between nerve cells, leading to the progressive neurological problems seen in MLD. The accumulating sulfatides also cause inflammation and damage to the brain and other organs. MLD is a rare disease. It's estimated to affect about 1 in 40,000 to 1 in 160,000 live births. Because it is an autosomal recessive disorder, both parents must carry the mutated gene for a child to be affected. If both parents are carriers, there is a 25% chance with each pregnancy that the child will inherit the disease, a 5% chance they'll be a carrier, and a 25% chance they won't inherit the gene at all. The signs and symptoms of MLD vary depending on the age of onset and the specific type of MLD. In general, symptoms progress over time. Common symptoms include difficulties with walking, muscle weakness, stiffness, and developmental delays in children. Speech problems, behavioral changes, seizures, vision loss, and cognitive decline may also occur. Eventually, MLD can lead to paralysis, loss of communication, and a vegetative state. Diagnosing MLD involves a combination of clinical evaluation and laboratory testing. Doctors often start with a thorough physical and neurological exam, considering the patient's symptoms and medical history. Blood and urine tests can measure aryl sulfatase A enzyme activity. Low or absent enzyme activity suggests MLD. Genetic testing can confirm the diagnosis by identifying mutations in the ARSA gene. MRI scans of the brain and spinal cord can reveal characteristic white matter abnormalities associated with demyelination. Nerve conduction studies can also assess nerve function. MLD is classified into different types based on the age of onset. The most common types are late infantile, juvenile, and adult onset. Late infantile MLD typically begins between 6 months and 2 years of age and is the most severe form, with rapid disease progression. Juvenile MLD starts between the ages of 3 and adolescence. Adult onset MLD has the slowest progression and can begin any time after adolescence, sometimes even in middle age. Currently, there is no cure for MLD. Treatment focuses on managing symptoms and improving quality of life. Supportive care, such as physical therapy, occupational therapy, and speech therapy, can help maintain function and manage complications. Pain management is essential. Hematopoietic stem cell transplantation, or HCT, is a treatment option that can slow the progression of the disease, especially in individuals diagnosed early, before significant neurological damage has occurred. Gene therapy is also an emerging treatment option that shows promise. Since MLD is a genetic disorder, there is no way to prevent it from occurring in individuals who inherit the mutated gene. However, genetic counseling and carrier testing are available for families with a history of LD. This can help parents determine their risk of having a child with MLD and make informed decisions about family planning. Prenatal testing, such as amniocentesis or chorionic villus sampling, can also be performed during pregnancy to determine if the fetus is affected. The prognosis for MLD depends on the age of onset and the type of MLD. Late infantile MLD has the poorest prognosis, with most individuals surviving only a few years after diagnosis. Juvenile MLD has a more variable course, with some individuals living in adulthood. Adult onset MLD tends to progress more slowly. Recent research has focused on developing new therapies for MLD, including gene therapy. Several clinical trials are underway to evaluate the safety and efficacy of these treatments. The hope is that these therapies will significantly improve the lives of individuals with MLD and their families.